Oh, there we go. Very nervous. Very nerve-wracking. Life-saving transplants, suspicious in-flight protocols, and you know what I always say, don't pull it out. Get ready to learn what emergency medicine is all about, because today we are breaking down and reacting to all of the traumatic medical scenes and life-altering injuries from the trauma code, Heroes on Call. All right, let's dive right in. Oh, wow. The knife is still there, and they were doing a good job of depicting them using the ambu bag, which is the blue device. That's a good way to give oxygen. He's in a head, tilt, chin lift type position. Just like I always say, the bleeding is at least contained because the knife is still there. It hasn't been removed, which can cause more issues. AKA, don't pull it out. This guy's pressure is horrible. 52/38, barely has a pressure. You got to get blood. You might need to do a massive blood transfusion protocol, which means you're using a ton of packed RBCs. Plus, you're going to be using other products like platelets and potentially FFP and cryoprecipitate. Oh no, we got bruising of the abdomen, meaning pooling of blood. Oh, there it is. Oh. So saw bruising of the skin, which then makes, oh, let me check to see if there's something going on with the heart. So they're listening to heart sounds. So if you hear muffled heart sounds, you worry about fluid around the heart. So pericardial tamponade occurring in a situation where the patient's heart rate is high and blood pressure is low. Oh, there we go. Very nervous. Very nerve-wracking. Nice. That is the new head trauma surgeon that comes in, take out the knife out of the abdomen. Now that the patient is stabilized, they can get the individual to the CT scanner, so you can do a CT of chest, abdomen, pelvis, see if there's any other issues, if there's bleeding in the abdomen now that they actually took out the knife. Oh, helicopter. Oh my gosh, okay. When I was a medical student, had the opportunity to get into a helicopter because I worked at a facility that did helicopter medicine, basically, where the residents would go on the helicopter, but nothing to this scenario. Teaching moment, pneumothorax, nice. Tension pneumothorax. Somebody can have a simple pneumothorax versus a tension pneumothorax. A simple pneumothorax is a collapsed lung, hasn't caused tension yet. Tension means it's starting to push and collapse down, pushing across, causing vascular compromise between your heart and your blood vessels, and so it needs to be fixed immediately. Air must come out, yes. There you go. So they're going anterior, second, third intercostal space. This doesn't necessarily get all the air out. You can hear a rush sometimes of the air, but taking a syringe with an empty syringe and actually sucking some of the air out will also be of benefit in this situation. You should be coughing because the lung is supposed to start to reinflate and it causes irritation. When we do chest tubes in the emergency department, this is the same thing that would happen. So they don't know where the hemorrhage in his head is, so they can't just do like a burr hole in somebody's head to relieve any hemorrhage that's in there because you don't know where it is. And a lot of times they'll actually do a procedure called a ventriculostomy, where they basically will do a burr hole and access one of your lateral ventricles and take the CSF out of it to decompress it to allow the brain to swell actually a little bit more. The stomach is massively distended. Oh, hemoperitoneum. Wow, why do they call it? How do they know it's all blood in the abdomen?
아니 지금 아무 검사도 안 하고 마취 안 한 것도 저 지금 굉장히 찝찝하거든요.
Ooh, nice.
떨어지잖아 이 새끼야. 수업 때 빨리
Ah, that's up by his chest. So interesting, the anesthesiologist is uncomfortable doing any anesthesia without any blood tests. Come on, I get it, you're protecting yourself. You want to know maybe if the patient has renal failure, what their blood volume is. It's an emergency, so what you would end up doing is treating it like that until you actually had the test, and the test would be sent off, and you'd get them pretty fast.
BP 계속 떨어집니다. 60에 40입니다.
So blood pressure is dropping in the operating room. How do you get the blood pressure up? You need to use ionotropics. So basically medications that help. Chronotropics, you have ionotropics, different medications to get things to tighten up, so to speak, and to squeeze harder. So you're doing that, and well as giving volume. So you need to give fluids plus blood.
교수님, 다음에 어떡할까요? 교수님! 교수님 이러다가 환자 놓치겠다고요. 이 정도 출혈이면 동맥이야.
So with that much amount of bleeding, and now he's thinking it's arterial. Your blood pressure is now normal, 123/70, heart rate is 72. The pulse ox, which is the oxygenation saturation, is 97%. These are all good numbers, and the monitor looks good.
항원 이제 엄니 걸고 출혈 보이는 거 싹치죠?
예. 근데 간은 어쩌죠? 여길 다 뒤질 수도 없고.
간파열이라.
So good questions. What do we do? In medicine, we do base everything on probabilities, but it doesn't mean if it's a slim chance that we do nothing. We keep going until a patient or family members tell us to stop. So the liver is potentially the problem and maybe why he's not surviving. Could you get a liver transplant? Depending on the reason why the individual has a liver disease.
교수, 우리 지영이부터 살려주면 안 될까?
Oh, jeez.
지금 당신 딸 살리러 간다고. 당신 때문에 지체된 시간만큼 당신 딸이 더 위험해진 거야, 알았어?
Wow. I mean, it is true. So, a different scenario at the hospital, we'll have a lot of family members come into rooms and ask a lot of questions while a lot of the resuscitation is going on. And our job is to do the resuscitation and treat the patient. And yes, we want to explain things to family members, but if we're explaining things, we can't be actually doing our job too to help save that individual's life. Resuscitative medications that we would use is epinephrine every 3 to 5 minutes. You're doing CPR every 2 minutes, and then you can potentially use vasopressin as well. They actually found that high quality CPR and defibrillation are the best things that you can do when somebody's in cardiac arrest.
냉정하게 정확하게. 알겠습니다. 다들 못 들어가고 있어. 재상 연기 준비해. 예. 시원아. 나 완전. 가서 막아.
네, 알겠습니다.
So this is true. Family member trying to get in the room, and you're not thinking clear-minded, even though you might think you are. You need to let people do the job that are trained, and you need more of the emotional support. This is your role. The trauma code, Heroes on Call. This is pretty accurate. It's up there at one of the most accurate shows. I definitely want to watch more of it, but I also don't want to watch more of it because I know I definitely need to react to this more. So if you guys enjoyed this, please let me know. Do me a favor. Definitely binge watch this playlist right here. Watch everything. And as always, please make sure you subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.